When it comes to preventive dentistry, a lot of new things are coming up. I think more on the follow-ups, more on education, educating the patients more. I think MouthCAM device is the phenomenal one. And with the AI power, I think it will enable the patients to actually provide more care. I would say it would enable them to change their habits on taking care of their oral health.
Most dentists aren't trained to run businesses, let alone scale them. This is the TechDental Podcast for dental leaders who want more than just tips. We give you systems, strategies, and straight answers. I'm Dr. Randeep, and each week I sit down with the operators, AI founders, entrepreneurs, and business leaders who are reshaping what's possible in dentistry. If you want a smarter, scalable, future-proof practice, then this is the podcast for you. With over 20 years of experience in technology and healthcare innovation, Shiva has played a key role in shaping Dentulu into a comprehensive digital ecosystem that empowers dental practices to enhance patient care and streamline provider workflows. In today's conversation, we'll explore how AI-powered technologies and diagnostic tools are transforming preventive dentistry, driving early detection and helping dental professionals deliver proactive care. We'll also dive into the future of digital dentistry and how platforms like Dentulu are making it easier for both patients and practices to access top-quality, tech-driven dental services. Welcome, Shiva.
Hi.
Thank you for coming on the podcast. It's great to have you on and great to have your perspective. So I'll just kick off, first of all, Shiva. So Dentulu is revolutionizing the dental industry with telehealth solutions and AI. How do you see AI and telehealth driving early detection in preventive dentistry? And what impact do you believe that these technologies will have in the next 5 to 10 years?
So that's a great question. But first of all, good morning, good afternoon, good evening, wherever we are. So a pretty interesting question. I think that's where we are right now. That's what we are dealing with. In terms of AI in dentistry, we have seen that educating the patient or educating the providers, education is very important because, that we call it as differential diagnosis. Obviously, you'll be aware of what differential diagnosis is. So with the use of AI, the differential diagnosis is getting better and better. So when the outcomes are getting even, much accurate. So let's say we build an AI widget, which basically is an agent. And when you take a picture and you feed it into this specific widget, it starts giving you, like, telling you what's going on inside your mouth. Now, this was something was not there. So before you go to a dentist, you want to understand. Let's say take the patient's perspective. Before you go to a dentist, you have to basically see what's going on. So for getting an appointment in the US is so difficult. So for small things, you cannot get an appointment. You can't go to the dentist. So you basically have to do some checks. So this is where the AI and the digital dentistry kind of started to play an important role. And initially, it started as photo consultations. They take a picture, send it to someone, and then they look at it. They start saying, okay, this is what is going on in your mouth, and you need a consultation. You have an in-person visit. That's the way it was. Even Dentulu was built behind that. As soon as AI and machine learning and all those things started to come up, this became even more easier. Now the doctor does not have to get involved until a point the patient sees that, okay, this is what is going on. Even the widget is designed in a way that it is not an actual diagnosis. Definitely the doctor has to come in, has to give his views, he has to review the case. So I think this is like a massive improvement to preventive dentistry. So it actually tells how the patient can actually improve their oral health, how they can actually, avoid certain diseases. So these are all important improvements which is happening because of AI. When it comes to the providers, I see that providers, before they make a decision or before they complete a diagnosis, the AI tools have started to help them in, making the decisions more effectively. It doesn't actually, is reducing the skill, or, it's not something there to, stop their work. It is there to actually help their work. It is actually upskilling everyone. That's what I would say, because when you take an example of, programmers or coding, the way we tell our developers is you have to start upskilling yourself, because now it's like clean code. You write clean code, you have clean documentations, less bugs. So that kind of is what happens with the doctors too. They're very skilled, experienced, but still there's something they might not see, which the AI can see and tell them like this is what is happening. So when you look at this in the next 5 to 10 years, even next 2 years, I would say this is going to have a massive growth, and this is going to massively impact on how the solutions are going to work, how the primitive dentistry is done, how the doctor is actually making decisions. It's going to simplify and it's going to reduce the burdens. I'm sure the healthcare professionals are already overloaded. There is a shortage of 6,500 professionals or dentists in the US as far as the data from 2023 to 2024. But there we basically, we can fill this gap where it reduces the burden. Though it is not a final diagnosis, it reduces the burden, and then it helps the providers to make decisions faster. And that's how I see it.
Yeah, I think that's a great point you made. I mean, access here in the UK is also a big problem. So something like this, yeah, anything which can improve patient access to care in a timely fashion, I think is going to be good before things escalate. So that's fascinating. In terms of take for example salivary testing and diagnostic tools. These are key to preventive care. How do Dentulu's offerings like AI-powered diagnostics enhance early detection of common dental issues and empower dentists to make more informed decisions? What's the feedback that you've got from the providers? How has this helped them in their day-to-day workflow?
I would say it's phenomenal. That's what I hear from the dentists. Like it helps them phenomenally. Let's say if they want to review an X-ray, right? And obviously they take an X-ray. They advise X-rays for patients every day, and they take an X-ray. And then if there's something, they're very experienced. They can see it. But over that, when they pass this on to the AI, it identifies and gives them like more conditions. Like maybe there are like 15 different conditions it looks for, 18 different conditions it looks for. So it might say like there are like 10 different issues I find on this, but doctor would have already told two things to the patient. They don't want to make the patient like really worry about what's going on. So they may say the important ones, and they already know which basically what the patient is having, and using this they can do a continuing care for the patient. They can provide continuing care to the patient. So that's what I think, like it's going to offer the continuity of care, because there are some issues which the doctor might not have seen, and the doctor would actually come to know that, okay, this is a condition which they don't have to tell the patient immediately, but later on, the continuity of care could happen, and that would improve because of this.
So almost you can pick things up at a much earlier stage.
Correct.
Essentially.
Right.
Fantastic. And what role does predictive analytics play in preventive dentistry? I mean, can AI and data analytics truly predict dental health issues, based on a patient history? And if so, how can practices leverage this technology, currently? And how accurate is this data?
I would say data is very important for AI, right? Structured data, and obviously in the Western countries, data is very structured. Even then, there are challenges to handle the structured data. Now, depending on 100% on this data, how accurate this is going to give me the result, it's not 100%. AI is not 100% there. It's like 90%, maybe 95% or 92%, but it's not 100%. So relying on this 100% is not going to happen. It's like, I wouldn't say it's not going to happen. It's far away, a little bit far away. But for now, dentists making a decision, practices making a decision, depending on these AI outputs, yes, it can give them 90% of accuracy. Over that, they have to put their experience and fine tune it before they, compute the decision. That's what I would say. But it's definitely around the structured data, and it's definitely around 90 to 92% accuracy. This accuracy level would increase, but I don't think it can challenge the human brain. But many have the views that it's going to challenge human brain, and it's going to be, it's going to be way better than human brain. But I believe like it will be there to support the humans. I don't think it can do something like what human brain does.
Yeah, I think that's what I'm hearing from a lot of professionals in the area. Now you have this hype there that it's going to take over and can do everything, but yeah, it's very much what I'm hearing from you is more of a collaborative approach, using it almost like as a co-pilot and co-decision maker, and then you've got the human oversight there as well, which is the way it should be in a regulated field like healthcare. And another question I have, early detection, it can prevent many issues, as you've discussed. Many practices are still heavily focused on reactive treatment rather than the prevention. How does Dentulu help shift dental professionals' mindset towards a more proactive approach to patient care? I mean, how have you found that them using this software? Does that help to create any kind of shift that you've seen in their thought process?
See, let me give you an example. So we do two three placements. Okay, so we work with labs and partners. Now the doctors actually use our. We are not skipping the doctors in the process, which I think companies like Smile Direct did that. So we are not skipping any of our doctors from the process. So every case which is being sent to us is reviewed by the doctors, and then the doctor basically using these outcomes to say if the patient is an eligible candidate and they can get a tooth replacement, and they make a decision, and this case gets approved, and then the tooth is replaced, and they get the product. So that works. Now, here, if I exactly say Dentulu is helping in making these decisions, we have predefined references, we have predefined set of templates to these doctors to help them make a decision. So, looking at that process, it helps the dentist to decide whether they can actually approve this case, and they recommend that they see the actual STL files, they review those files, and then they make a decision on whether this patient can go through the whole process. So as far as we have seen, the acceptance by the providers and being phenomenally great. They are adapting to the system because that is also creating an income stream for them. While signing off cases, or getting involved in the decision making, because dentists are required for making these decisions. Because these decisions cannot be made by a software or AI. Dentists are required to make those decisions. So the acceptance has been great, and we also see that that is actually helping them in making the decisions, whether the patient is an eligible candidate or the patient has to go through the treatment. So yeah.
Fantastic. So we've touched on, obviously, you've got the dentists and the experts there who are helping to triage all of this. So it's the final judgment is on the clinician. In terms of the patient engagement side of things, I mean, how does Dentulu use technology to improve patient education, to encourage proactive involvement in their oral health, especially in the telehealth context? I mean, how have you managed to do that education side of things from a patient's perspective?
So, obviously, patient education matters a lot. You provide them with patient education resources such as patient education videos. We have a lot of patient education videos. We have them available free of cost for them to access it from their phone. They are on our website. They can access those, and then we also we also tell them, we have created a device called MouthCAM. I'm not sure if you had a chance to look at that. So that is an educational device. It's not like an FDA approved device. It's an educational device. We encourage them to take this as like $50, $100 camera, which they can buy this from Amazon or from our website or anywhere. And then they can actually keep this. It's like a toothbrush. They can put it inside their mouth, and then they take in pictures. And then either they can see themselves what's going on inside the mouth, or they can send it to their providers, their dentist, anywhere they are. They can send it through a chat. They can send it through the HIPAA compliant, end-to-end encrypted chat, or they can put it on the app. So we have created these kind of education. MouthCAM is one of the phenomenal tool, I would say, is like the best education device, because it makes them, as much as you say, brush twice daily, you brush after you eat. So similarly, we have been pushing this MouthCAM so much to the patients and to the providers to use it as an educational device, because this can be also used as a post-operative checkup device. So let's say if there is a procedure done and the patient has to come in after 2 weeks, now the patient doesn't have to come in. The provider can give this camera to the patient. They can take it to their homes. They can sign into the app, connect the device, take pictures. It goes straight into the patient's chart, which the providers can review from wherever they are. And if everything seems okay, the patient does not have to come in. The doctor can, let them know when they have to come in. I would say MouthCAM is one of the phenomenal device we have done, and now we have integrated that with AI. So these images can be passed through the AI agent, which basically tells them, gives them more information. Okay, what is happening inside the mouth, and it also tells that you need to see the dentist or you. And yeah, obviously we give a disclaimer that this is not like this is just a generated information, or you may need to speak to a dentist to arrive at the final decision. So these are some of the efforts, and one of the best thing I would say is MouthCAM. Sending a MouthCAM device with the patient to homes is a phenomenal drive we did, which kind of increased the efficiency in handling post-operative checks, changing the user's habits. How it's like a brush. So yeah.
So have you found that it's improved actual follow-up and recall? Because I think one challenge in preventive dentistry is the follow-up and the recall once you've identified something. So have you found that this has helped actually bring up those recall rates for the patients?
We have seen the offices using that, and then we have seen following up with the patients, and then we have seen a drastic increase in how they do the follow-ups, and we have seen a reasonable increase in that. Yeah.
In terms of actually on the clinician front, what advice would you give to dental practices or owners who want to adopt early detection tools like this, but without disrupting their current operations or adding too much complexity? I mean, how does it slot into their current software systems and workflows?
I would say that's the biggest challenge. Nobody wants to spend their time on training their staff. They don't want the business to stop. Dentists they want.
They just want it to work outside, straight out of the box and plug and play.
Nobody wants to waste time, So that's the challenge we face all the time, and so that needs a lot of hand-holding initially. Yeah, you definitely need a lot of hand-holding with the providers, with the patients. You definitely need a lot of hand-holding. Dentulu, it had been a very big challenge. So we have a team of client support executives or onboarding specialists who basically tell them through this process of onboarding and getting onto our system, training them. So that's one piece of it. But actually helping them to make decisions is like, do you integrate with practice management system? Yes, we do. We do integrate with the practice management system. So obviously any data put into our system can go into that system. We help with the initial onboarding, and initial onboarding setup is like 70 to 80% automated. 20% they may need some hand holding, which basically our team does. Post they are set up, we bringing their providers onto our system, giving them initial training. We have mobile apps for the providers. We have mobile apps for the office, which they can actually give it to the patients, which would allow them to we should allow the patients to stay in touch with the office. So we have created the ecosystem in a way that they would be easily able to adapt to the system. I would say, it's easy and this and that, but it's still, convincing them and bringing them to start using a new system without affecting their business is always a challenge. But we have figured out a lot of automation in the process, and we have tried to reduce that to like 80% of automation and then 20% of hand holding. And we do have continuous support and teams to help them, start using it.
And what's next for preventive dentistry? I mean, with the rapid growth of dental technology, do you foresee kind of new innovations or integrations, perhaps with wearable tech or remote monitoring? I mean, what's your thought process on that? What are you seeing from being at the forefront of this?
When it comes to preventive dentistry, a lot of new things are coming up. I think more on the follow-ups, more on education, educating the patients more. I think MouthCAM device is the phenomenal one, and with the AI power, I think it will enable the patients to actually provide more care. I would say it would enable them to change their habits on taking care of their oral health. Because there's one more thing which I didn't even speak about is salivary testing. Salivary testing is like one of the major thing happening, because it has we don't give attention to our systemic health. Systemic health is so much connected to your mouth, to your oral health. So your oral health starts. How do you identify your oral health? Yeah, salivary testing. So we do tests for 12 different bacteria. We work with huge labs like Oral DNA, Biome, and we offer that as a full service. Now, that one thing is something very, very phenomenal. It's becoming very inclusive in every other practice, and every other practice should start doing salivary testing because the mouth is so much connected to the body. The bacteria in the mouth can go to your brain. That's how serious it is. So it's very fascinating. That's what is happening right now, and the future is like salivary testing is one of the important things which everybody should become so inclusive about.
Yeah, no, I second that. I think it's expected in medical practices. They have all these different tests. You go to the dentist, and people think you're just there to have a filling or a crown. But yeah, it's a good point you make. A lot of the prevention markers that you can get from the salivary testing. Yeah, that's an amazing point, and I'm hoping it comes in more and more into general dental practice as well. In terms of the opportunity for AI to enhance the efficiency of preventive dentistry and especially the patient experience in preventive dentistry, where do you see is the biggest opportunity now as AI is advancing at such a rapid pace? So, what's the next opportunity in terms of enhancing patient experience in the preventive dentistry arena? Where do you see that advance in AI technology really helping enhance the patient's experience of going and having one of these preventive tests done in terms of speed, efficiency, and workflow as well from a patient's point of view?
Okay, so this is going to improve like they are going to get more. The accuracy levels are going to increase. Obviously, there's going to be a lot more data they will have hands on, and the patients would be able to make decisions faster because there are logistical issues, but I think we cannot handle certain logistical issues beyond the artificial intelligence or all those things. That's beyond that. But when it comes to with the increase of AI and focus on preventive care, I think patients will start getting solutions and answers much faster whenever they need it. Just like Google, it's going to be like there was like a .com wave 25 years back when everybody started to have a website, everybody started to have a web page. Started replacing business cards, right? So similarly, I think now it's the AI wave. The access to information or access to accurate information is going to increase much faster, and people are going to get their answers much faster. So that is going to make a shift in user habits. And obviously that habits will impact how they actually take care of their health. Just like how when Apple Watch came, people shifted to more into tracking their health, more tracking in how much I walk, how much I run, So the habits are going to change with this introduction of, different AI tools. The way patients are actually taking care of their health is going to change. So that's how I see it.
So, kind of democratizing access into kind of giving that power back into the hands of the patient, so they can actually get that quicker, easier. So it all comes down to the access again, improving the access and improving the information quality as well, not just the speed, but the quality. How would you talk to practices who maybe they're a little bit hesitant about embracing new technologies in the preventive dentistry arena? So just to help them get started, maybe if they're right at the beginning of a journey and they don't really know much about the tech, but they're keen to introduce something like this, what would the first step be for them?
No, I think first we have to tell them like what are the outcomes, how much. I think there are a few different things we have to tell them. It's right. It's also a business, even though the patient care is the primary focus. It's also a business, right? They want to. Every business wants to make money. It's not about making money always. It's about like patient care. Patient care is the first. It's the primary thing. So first we have to tell them what their patients are getting, right? Initially, we have to show them what their patients are getting. So let's say we do a lot of sleep apnea services. We do at least like 100, patients a month. Now, sleep apnea is a huge area. So we have to show them the importance of, there may be patients who are coming into them and with a sleep apnea problem, and that can be actually fixed by a dentist. We call it as like they have to do a 2 to 3 weeks of process and also covered by insurance. They give them like a mandibular device. They don't have to wear a mask. It's called as a CPAP device. So they have to put that mandibular device, which is to be custom designed by a dentist. So we have to tell them what are those specific services which is going to help the patients, which they may not be seeing. And these things can be done by a dentist. And then once they see the value and how we are actually automating this process using the software, then the network and the training and what is the support we are offering, I think they will get convinced about, and we have to tell them like how inclusive this is in their existing workflow. It is not something you have to learn something new, though it may be a new service you want to offer or a new treatment you want to offer, but it's so inclusive in your existing process. So if they start feeling that it's inclusive in my existing workflow, I don't think they would say no to it. They will start adapting to it, and they would say, I would need this. Yeah, I would want this.
That's absolutely fascinating and spot on. I mean, now, Shiva, towards the end of the podcast, I like to do like a little lightning round, which is more into the kind of mindset of yourself. I mean, you mentioned your entrepreneurial journey. So there's a couple of quick fire questions. First of all, what one book, podcast, or article has been most significant for you in terms of your thinking about technology or innovation? I mean, what's something that it's really changed the way or rewired the way you think about technology and innovation?
When it comes to entrepreneur journey, the one book I cannot forget is You Can Win by Shivakumar. That kind of changed the way I think, how I saw the entrepreneurship and how actually I looked at things. Completely changed the way I was. So I would say, even if it's a 20-year-old book, I think it can maybe come something around in 2000. But it's a very fantastic book. Everybody should read that. And that will kind of like have a very, very great impact on the way you think, how you see the positive and negatives all the time.
A lot of these principles are timeless. I think that's it. It's not so much the age of the book, but some the good ones, they have timeless principles.
Yeah, timeless principles. And I think the other guy, the guy from the UK, what is his name? The monk. He was a monk actually.
Oh yes, yeah. With the Ferrari.
With the Ferrari, yeah.
Yes.
So that is another book. Fantastic. I would say is one of the fantastic books. In terms of technology, I would say I'm a self-learner. So, I've referred a lot of these Python, and my love for Python has been very, very, explicit. So Python is kind of my choice, but I have been reading a lot of those articles and a lot of things associated around that. Yeah.
Fantastic. Yeah, just so that book, just for our listeners, it's Robin Sharma. It's The Monk Who Sold His Ferrari. And finally, if you could shadow for a day one entrepreneur, somebody you admire, past or present, and just kind of learn from them for a day, who would it be?
So I would say Ratan Tata. He's one of the greatest entrepreneurs. You should actually inspire about the way he works, how shrewd he is, and how he does the business. Ratan Tata is like one of the greatest inspirations anyone can have. So he's kind of like my inspiration. And there's quite a number of people, but I think I would say Ratan Tata.
Fantastic. Shiva, we've come to the end of the podcast. It's been fascinating. Thank you so much for your insights and your time today. It's been great.
Fantastic. Thank you, Randeep.
Scaling a business isn't a dream, it's a decision. This is the TechDental Podcast. And if you found value today, follow, share, and subscribe. This is the edge every dental leader needs.